Hi doctors, good afternoon. Today our topic is all about the joints of the lower extremities. We'll be focusing more on the hip joint, the knee joint, and the ankle joint. Please make your notes as your study guide, and these are the things that you should make notes of. The bones involved, the type of joint, the articular surface, the ligaments, the blood supply, the nerve supply, and the movement. On the last part of the video, we will also be talking about the foot as a functional unit. So we will be talking about the arches of the foot and how the mechanism on how we walk. So let's begin. We will start cephalotocaudal. So our first joint will be the hip joint. The hip joint is the articulation between the hemispherical head of the femur and the cup-shaped acetabulum of the hip bone. The type of joint, this is a synovial ball and socket joint. Articular surface of the acetabulum is horseshoe-shaped and is deficient inferiorly at the acetabular notch. The cavity of the acetabulum is deepened by the presence of fibrocartilaginous rim called the acetabular labrum. The labrum bridges across the acetabular notch and is here called the transverse acetabular ligament. The articular surfaces are covered with hyaline cartilage. The joint is enclosed by a capsule and attaches to the acetabular labrum medially. Now for the ligaments of the hip joint. The first ligament, the Iliofemoral Ligament, is a strong, inverted Y-shaped ligament. Its base attaches to the anterior inferior iliac spine above, and below, the two limbs of the Y attach to the upper and lower parts of the intertrochanteric line of the femur. This strong ligament prevents overextension during standing. Remember, it is Y-shaped. Next ligament is the Pubo-femoral ligament. This is triangular. The base of the ligament attaches to the superior ramus of the pubis, and the apex attaches below the lower part of the intertrochanteric line. This ligament limits extension and abduction. Next is the Ischiofemoral Ligament. It's a spiral shape and is attached to the body of the ischium near the acetabular margin. The fibers pass upward and laterally and attach to the greater trochanter. This limits extension. Next is the Transverse Acetabular Ligament. It's formed by the acetabular labrum as it bridges the acetabular notch. The ligament converts the notch into a tunnel through which the blood vessels and nerves enter the joint. So remember, the transverse acetabular ligament converts the notch into a tunnel through which the blood vessels and nerves enter the joint. Last is the ligament of the head of the femur. This is a flat and triangular. It attaches by its apex to the pit on the head of the femur, or the fovea capitis, and by its base to the transverse ligament on the margins of the acetabular notch. It lies within the joint and is ensheathed by synovial membrane. Remember, the names of the ligaments shows its location, the pubofemoral ligament, the ischiofemoral ligament, so take note of that. Next, as for the synovial membrane of the hip joint, the synovial membrane lines the capsule and attaches to the margins of the articular surfaces. It covers the portions of the neck of the femur that lies within the joint capsule. It ensheaths the ligament of the head of the femur and covers the pad of fat contained in the acetabular fossa. As for the blood supply, retinacular branches of the medial and lateral circumflex femoral arteries and arteries to the head of the femur comes from the acetabular branch of the acetabular artery. As for the nerve supply, the femoral nerve, obturator, and sciatic nerves, and the nerve to the quadratus femoris supplies the area. For the movement, flexion is performed by the iliopsoas, rectus femoris, and sartorius, and also by the adductor muscles. The hip joint can also extend. As for extension, This is a backward movement of the flexed thigh. It's performed by the gluteus maximus and the hamstring muscles. Abduction is performed by the gluteus medius and minimus, assisted by the sartorius, tensor fasciae latae, and piriformis. Adduction is performed by the adductor longus and brevis and the adductor fibers of the adductor magnus. These muscles are assisted by the pectineus and gracilis. For the lateral rotation, this is performed by the piriformis, obturator internus and externus, superior and inferior gemmelli, and quadratus femoris. This is assisted by the gluteus maximus. For the medial rotation, it is performed by anterior fibers of the gluteus medius and gluteus minimus and the tensor fasciae latae. Circumduction is a combination of the previous movements. Our next joint will be the knee joint. The knee joint is the largest and most complicated joint in the body. It consists of two main parts. The first part is the paired condylar joints between the rounded medial and lateral condyles of the femur above and the corresponding condyles of the tibia and their cartilaginous menisci below. And number two, a gliding joint between the patella and the patellar surface of the femur. So the type of joint, the joint between the femur and the tibia, is the synovial joint of the hinge variety, but some degree of rotatory movement is possible. Second, the joint between the patella and the femur is a synovial joint of the plain gliding variety. The capsule is attached to the margins of the articular surface and surrounds the sides and posterior aspects of the joint. Now, I would like to share to you a video, a tutorial basically explaining the ligaments of the knees. It clearly explains and animates the knee so that you can understand it better. So take note of the ligaments, the medial collateral, the medial collateral ligament, the lateral collateral ligament, the anterior cruciate ligament, and the posterior cruciate ligament. Note also for the menisci and its functions and how it helps stabilize our knee, and also the nerve supply and the blood supply is discussed. So here's the video.
A well-functioning knee joint is critical to mobility, including standing, walking, and running. To better understand how knee problems occur, it is important to understand some of the anatomy of the knee joint and how the parts of the knee work together to maintain normal function. The important structures of the knee can be divided into several categories. These include bones, joints, ligaments, tendons, muscles, nerves, and blood vessels. First, let's define some common anatomic terms as they relate to the knee. This will make it clearer as we talk about the structures later. Many parts of the body have duplicates, so it is common to describe parts of the body using terms that define where the part is in relation to an imaginary line drawn through the middle of the body. For example, medial means closer to the midline, so the medial side of the knee is the side that is closest to the other knee. The lateral side of the knee is the side that is away from the other knee. Structures on the medial side usually have medial as part of their name, such as the medial meniscus. The term anterior refers to the front of the knee, while the term posterior refers to the back of the knee. So the anterior cruciate ligament is in front of the posterior cruciate ligament. The knee is the joint where the femur and the tibia meet. The patella, or kneecap as it is commonly called, is made of bone and sits in front of the knee. The knee joint is a synovial joint. Synovial joints are enclosed by a ligament capsule and contain a fluid called synovial fluid that lubricates the joint. The end of the femur joins the top of the tibia to create the knee joint. Two round knobs called femoral condyles are found on the end of the femur. These condyles rest on the top surface of the tibia. This surface is called the tibial plateau. The outside half, the farthest away from the other knee, is called the lateral tibial plateau, and the inside half, closest to the other knee, is called the medial tibial plateau. The patella glides through a special groove formed by the two femoral condyles called the patellofemoral groove. The smaller bone of the lower leg, the fibula, never really enters the knee joint. It does have a small joint that connects it to the side of the tibia. This joint normally moves very little. Articular cartilage is the material that covers the ends of the bones of any joint. This material is about 1/4 of an inch thick in most large joints. It is white and shiny with a rubbery consistency. Articular cartilage is a slippery substance that allows the surfaces to slide against one another without damage to either surface. The function of articular cartilage is to absorb shock and provide an extremely smooth surface to facilitate motion. We have articular cartilage essentially everywhere that two bony surfaces move against one another or articulate. In the knee, articular cartilage covers the ends of the femur, the top of the tibia, and the back of the patella. Ligaments are tough bands of tissue that connect the ends of bones together. Two important ligaments are found on either side of the knee joint. They are the medial collateral ligament, or MCL, and the lateral collateral ligament, or LCL. Inside the knee joint, two other important ligaments stretch between the femur and the tibia. The anterior cruciate ligament, or ACL, in front, and the posterior cruciate ligament, or PCL, in the back. The MCL and the LCL prevent the knee from moving too far in the side-to-side direction. The ACL and the PCL control the front-to-back motion of the knee joint. The ACL keeps the tibia from sliding too far forward in relation to the femur. The PCL keeps the tibia from sliding too far backward in relation to the femur. Working together, the two cruciate ligaments control the back and forth motion of the knee. The ligaments, all taken together, are the most important structures controlling the stability of the knee. Two special types of ligaments, called menisci, sit between the femur and the tibia. These structures are sometimes referred to as the cartilages of the knee. But the menisci differ from the articular cartilage that covers the surface of the joint. The two menisci of the knee are important for two reasons. One, they work like a gasket to spread the force from the weight of the body over a larger area. And two, they help the ligaments with stability of the knee. Imagine the knee as a ball resting on a flat plate. The ball is the condyles of the femur, and the plate is the tibial plateau. The menisci actually wrap around the round condyles to fill the space between it and the flat tibial plateau. The menisci act like a gasket, helping to distribute the weight from the femur to the tibia. Without the menisci, any weight on the femur will be concentrated to one point on the tibia. But with the menisci, weight is spread out across the tibial surface. Weight distribution by the menisci is important because it protects the articular cartilage on the ends of the bones from excessive forces. Without the menisci, the concentration of force into a small area on the articular cartilage can damage the surface, leading to degeneration over time. In addition to protecting the articular cartilage, the menisci help the ligaments with stability of the knee. The menisci make the knee joint more stable by acting like a wedge set against the bottom of a car tire. The menisci are thicker around the outside, and this thickness helps keep the round femur from rolling on the flat tibia. The menisci convert the tibial surface into a shallow socket. The socket is more stable and more efficient at transmitting the weight from the upper body than a round ball on a flat plate. The menisci enhance the stability of the knee and protect the articular cartilage from excessive concentration of force. Taken all together, the ligaments of the knee are the most important structures that stabilize the joint. Remember, ligaments connect bones to bones. Without strong, tight ligaments to connect the femur to the tibia, the knee joint would be too loose. Unlike other joints in the body, the knee joint lacks a stable bony configuration. The hip joint, for example, is a ball that sits inside a deep socket. The ankle joint has a shape similar to a mortise and tenon, a way of joining wood used by craftsmen for centuries. Tendons are similar to ligaments, except that tendons attach muscles to bones. The quadriceps tendon connects the large quadriceps muscle of the thigh to the patella. This tendon continues across the patella, or kneecap, and blends into the patellar tendon. The patellar tendon connects the patella to the tibia. The hamstring muscles on the back of the thigh also have tendons that attach in different places around the knee joint. These tendons are sometimes used as tendon grafts to replace torn ligaments in the knee joint. The extensor mechanism is the motor that drives the knee joint and allows us to walk. It sits in front of the knee joint and is made up of the patella, the patellar tendon, the quadriceps tendon, and the quadriceps muscles. The 4 quadriceps muscles in front of the thigh are the muscles that attach to the quadriceps tendon. When these muscles contract, they straighten the knee joint, such as when you get up from a squatting position. The way in which the kneecap fits into the patellofemoral groove on the front of the femur and slides as the knee bends can affect the overall function of the knee. The patella works like a fulcrum, increasing the force exerted by the quadriceps muscles as the knee straightens. The hamstring muscles are the large muscles in the back of the thigh. When these muscles contract, the knee bends. The most important nerves around the knee are the tibial nerve and the common peroneal nerve in the back of the knee. These 2 nerves travel to the lower leg and foot, supplying sensation and muscle control. The large sciatic nerve splits just above the knee to form the tibial nerve and the common peroneal nerve. The tibial nerve continues down the back of the leg, while the common peroneal nerve travels around the outside of the knee and down the front of the leg to the foot. Both of these nerves can be damaged by injuries around the knee. The major blood vessels around the knee travel with the tibial nerve down the back of the leg. The popliteal artery and the popliteal vein are the largest blood supply to the leg and foot. If the popliteal artery is damaged beyond repair, it is very likely the leg will not be able to survive. The popliteal artery carries blood to the leg and foot. The popliteal vein carries blood back to the heart. The knee has a somewhat unstable design, yet it must support the body's full weight when standing and much more than that during walking or running. So it's not surprising that knee problems are a fairly common complaint among people of all ages. Understanding the basic parts of the knee can help you better understand what happens when knee problems occur.
Next, we'll be talking about the ankle joint. So the ankle joint is between the lower end of the tibia and the 2 malleoli, the lateral and medial malleolus and the body of the talus. It consists of a deep socket formed by the lower ends of the tibia and fibula, which is fitted to the upper part of the body of the talus. It is like a mortise and tenon joint, which I will show you here, that is usually used by carpenters. The inferior transverse tibiofibular ligament, which runs between the lateral malleolus and the posterior border of the lower end of the tibia, deepens the socket into which the body of the talus fits snugly. The articular surface of this joint is covered with hyaline cartilage. The shape of the bones and the strength of the ligaments and the surrounding tendons make this joint strong and stable. The ankle, or the ankle joint, is a synovial joint, and the talus moves on a transverse axis in a hinge-like manner. The capsule encloses the joint and attaches the bones near their articular margins. Now, as for the ligaments, we have the medial ligament. This is a strong triangular unit composed of 3 parts. The first is the apex. It attaches to the tip of the medial malleolus. Then the deep fibers attaches to the non-articular area on the medial surface of the body of the talus. Next is the superficial fibers attaches to the medial side of the talus, the sustentaculum tali, the plantar calcaneo-navicular ligament, and the tuberosity of the navicular bone. Then, the lateral ligament is weaker than the medial ligament and consists of 3 bands. So the first band is the anterior talofibular ligament, runs from the lateral malleolus to the lateral surface of the talus. Next is the calcaneofibular ligament that runs from the tip of the lateral malleolus downward and backward to the lateral surface of the calcaneum. And the last is the posterior talofibular ligament, which runs from the lateral malleolus to the posterior tubercle of the talus. Now, the synovial membrane lines the capsule, and it is supplied by the deep fibular and tibial nerves. This will supply the ankle joint.
Several muscles and tendons are important for ankle joint function. The large Achilles tendon is the most important tendon for walking, running, and jumping. It attaches the 2 calf muscles, the gastrocnemius and the soleus, to the calcaneus and allows us to raise up on our toes. The posterior tibial tendon attaches the posterior tibialis muscle in the calf to the underside of the foot. This tendon helps support the arch and allows us to turn the foot inward. The anterior tibial tendon attaches the anterior tibialis muscle to the foot and allows us to raise the foot. The 2 peroneal tendons run behind the lateral malleolus and help turn the foot down and out. These 2 muscles and their tendons are called the Peroneus longus and the Peroneus brevis. As you might guess by the name, the Peroneus brevis is the shorter of the 2 and attaches to the base of the 5th metatarsal, while the Peroneus longus runs further before attaching under the foot.